You've had some difficulty getting out of the chair. The best things to do is to bring your feet underneath you and bring your nose over your toes and push up with your hands. Can you do that now?
I'll try.
Okay. That's it. And push up. Great. Can I see your gait? All right. And make sure you pick up your feet. And can you turn like that when we come back?
The purpose of our presentation is to focus on the signs and symptoms of Parkinson's disease and its impact on nursing care. Our objectives for this film are to identify primary, secondary, and associated symptoms of Parkinson's disease, to illustrate specific nursing interventions, and to describe comprehensive therapy for this population. Now, let's take a look at the 4 major symptoms of Parkinson's disease that you see every day. They are tremor, which results in shaking, rigidity, which leads to stiffness, bradykinesia, which produces slowness of movement, and postural changes, which appear as a shuffling gait. Here now are actual patient examples of the 4 major Parkinson's disease symptoms. Let's start with tremor. The tremor of Parkinson's disease is a resting tremor. It is a tremor that is seen when the person isn't performing any activity. It is a to and fro rhythmic movement that may involve the limbs, the mouth, the tongue, or the head. Generally, it is not disabling, but can be very embarrassing to the patient and the family. Does it affect your writing?
Yes, very much.
Yeah. Are you able to feed yourself okay?
Yes. The only thing is I can't cut the steak.
This tremor may cause social isolation. Even though this isolation is not disabling, it can decrease the quality of life for the patient. Our next example is that of rigidity. Rigidity is a stiffness in the muscles. Do you have other troublesome symptoms?
Yes, I have rigidity and a fair amount of stiffness.
It is seen as a cogwheel effect and ratchet-like movement of the joints. Rigidity can also cause a resistance to passive movement, with resulting shortening of the muscles and development of contractures. Our third example is of bradykinesia, which is a slowness and an inability to initiate movement. It may prevent patients from carrying out their daily activities and in turn increase your difficulty in caring for these patients. Our last example is that of postural changes, which produce balance and gait disturbances, as well as difficulty in turning. Most importantly, there's a tendency to fall. The patient also loses the ability to stop forward or backward motion. From the 4 major symptoms of Parkinson's disease, secondary and associated symptoms can arise. These secondary and associated symptoms are as disabling as the major symptoms. The secondary and associated symptoms may be grouped into 4 categories of nursing diagnoses. Let's examine the first category, alterations in mobility, which include falling, loss of arm swing, and gait disturbances. In order to maintain normal gait and prevent falling, the patient should be taught to think and concentrate before walking, and walk with the feet spread apart for better balance.
You've had some difficulty getting out of the chair. The best things to do is to bring your feet underneath you and bring your nose over your toes and push up with your hands. Can you do that now?
I'll try.
Okay. That's it. And push up. Great. Can I see your gait? All right. And make sure you pick up your feet.
It is not enough just to instruct the patient. The patient must provide you a return demonstration.
Then when you stand up, shoulders always go forward, spread your feet a little, and you stand.
Perfect.
And this way you can stand up tall. and you stand up straight. You try to. Then you will move them back a little. And the proper way of walking, first of all, when you stand, you always keep your feet at least 6 inches apart. It may not be ladylike,
That's okay.
but you're not going to fall.
And it's safe.
And it's safe, it's true. Also, it's a little Charlie Chaplin style, a little spread apart. And you always go with your heel down, heel first. Oh, I'm doing it wrong now. I gotta start all over again. I'm sorry. Heel, heel,
Perfect.
heel, heel.
Perfect.
The Parkinson patient has difficulty getting in and out of bed and chairs, which may make nursing intervention necessary.
You've had some difficulty getting out of bed. We should probably practice getting out of bed best way and safest way possible. Bringing your legs over first, wiggling your hips to the edge of the bed, and putting your feet on the floor and feeling them under you is the safest way. You want to try that now?
Yes.
Okay. First, legs. Feet on the floor. That's it. Okay. Good.
We also need to teach the patient to look up, exaggerate their arm swing, and pick up their feet while walking. Our second nursing diagnosis is alteration in communication. Facial expression and vocal communication provide transmission of ideas and enhance human interactions. Masked face and a decrease in voice are common problems in Parkinson's disease.
The senior citizens, and I go out more.
So you feel you're more functional
Yes.
now.
Yes.
What can we do to overcome these deficits? As a means of improving your voice, practice speaking loudly into a tape recorder, then play back your recorded voice to evaluate the results.
1, 2, 3, 4, 5. One, 2, 3, 4, 5.
To overcome masked faces and improve facial expression, you should instruct your patients to exercise their faces in a mirror. These exercises should be done every day. Oral exercises should be done on a daily basis to improve and strengthen coordination of the tongue and mouth.
My breath is hard to
Do you
catch.
feel like you could have problems expanding your lungs sometimes, or what does it feel
Just
like?
some difficulty in breathing, which I
Catching
never
your
had
breath?
before. Yeah.
Yeah. Breathing exercises should be done on a daily basis to maintain coordination of the diaphragm and strengthen speech. Our third nursing diagnosis is an alteration in sleep-wake patterns. Recommendations to maintain normal sleep-wake patterns include avoiding naps during the day, planning activities to prevent fatigue, and providing periods of rest and exercise. Patients with Parkinson's disease have difficulty with flexibility and coordination, which may impair their ability to perform activities of daily living. There are assistive devices to overcome these deficits, such as non-skid surfaces, plates with raised sides, weighted utensils, cups with adjustable grips, buttoners, and an assistive device to help put on the socks. Depression is associated with Parkinson's disease. It can be life-threatening. There is the risk of suicide and malnutrition. As nurses, you should always be aware of the patient's mental health status. In these patients, depression may be as subtle and as difficult to distinguish as the signs and symptoms of Parkinson's disease. Masked faces, slowness, withdrawal, weight loss, disturbed sleep, and a lack of motivation, which may look just like depression. Depression can affect all aspects of a person's life and can be just as disabling as Parkinson's disease.
Next step was, of course, to work on Parkinson. After I had a little depression. But there was 5 years of hell. Believe me, I climbed walls, I climbed mountains, I couldn't do nothing, I couldn't sleep. I lost a lot of weight.
You did?
I lost 35 pounds. I was down to 113 pounds. It was driving me crazy.
Yeah. And no matter what you ate, no matter what you
Nothing.
felt, you just didn't want to eat.
It didn't help. My poor wife, besides herself.
Yeah. In Parkinson's disease, depression may be of long duration and unrelenting. If left untreated, it can result in long-term hospitalization or death from suicide or malnutrition.
I was so devastated that thoughts of suicide came into my mind. And I couldn't get them out of my mind because I saw myself winding up as these patients as soon as it was diagnosed.
Pharmacotherapy is a major component of management for these patients. Parkinson's disease is a progressive neurologic disorder which is a result of gradual cell loss in the substantia nigra, a part of the basal ganglia located at the base of the brain. Substantia nigra cells produce dopamine. Dopamine is a neurotransmitter which facilitates communication between nerve cells that control automatic movements, muscle tone, and the smooth and rapid initiation of motor activity. When 80% of the substantia nigra cells are lost, there is a decrease in dopamine. This decrease in dopamine results in garbled messages between nerve cells, which produces observable symptoms. Sinemet enhances the ability of levodopa to enter the brain and replenish the balance of dopamine. Levodopa is used since dopamine will not cross the blood-brain barrier. As effective as this drug is, it has the following drawbacks. Dosages may not be titrated properly. Drug efficacy is lost over time. It causes its own serious side effects, which are as disruptive as Parkinson's symptoms. Current philosophy is to give Sinemet in as low a dose as possible and to build up slowly, to keep the levodopa as low as possible, below 300 to 400 milligrams a day. Adjunctive use of Parladil maintains symptom control and reduces the risk of long-term levodopa complications. Yeah, do you find people react to you differently now that you've had Parkinson's?
In the beginning, when I first told people I had Parkinson's, first I didn't tell anybody.
Yeah.
And then when I did tell people, I think there were a lot of people who were pretty nervous about it and were kind of backing off a little. But they've gotten used to the idea, and maybe I've gotten used to it more, and so I convey something different than I did before.
Even though Parkinson's disease is a progressive disorder, patient function and participation in activities of daily living can be greatly extended through appropriate nursing interventions and balanced comprehensive therapy.